Hi, I'm Dr. Kenrick Spence. I've been in practice over 20 years. I'm a board-certified plastic surgeon, certified by the American Board of Plastic Surgery. I want to share a little bit about our practice with you today. Our focus is not just your result, but the patient experience and your safety. We have a heavy concentration on facial plastic surgery, even though we do a lot of body contour and breast surgery as well. We've worked a long time on our facelift protocol, and patients are traveling from all over to undergo the operation. Again, we've worked on not just the safety and the result, but mainly the patient experience. What makes Hillcrest different is that we all in this practice get up every day and with the sole goal of making this the best plastic surgery experience every patient will ever have. And when you commit to that, the patients understand it and they appreciate it. So what we worked out is most places advertise sort of this mini facelift. But in my mind, mini facelifts give mini results. We have been able to give you a real facelift under local anesthesia with oral sedation, no different than if you'd had general anesthesia. So what we're doing is we're resetting, restructuring, reshaping the face and the neck to give a more youthful result. But it ought to be a blended result where the patient looks so natural but so much younger. An incision is made in front of the ear and along the hairline behind the ear, which 99% of the patients can put their hair up and not worry about it after a few months. Surgery typically takes anywhere from 2 to 3 hours, depending on what you're doing, and you're able to be up and moving about that night with a very, very smooth recovery.
Everyone, we're in the operating room with Hillcrest Plastic Surgery, and Pamela has asked that we do her surgery filmed live today. Pamela, would you like to say good morning so everyone knows that you're
Good morning, everyone.
awake and comfortable?
I am.
So today we'll be doing a facelift with SNAPs, which is a suspension of the tissues under the skin in order to promote a more youthful look, in addition to grafting with some fat into the face and the resurfacing of lines around the lip. You're pretty comfortable so far, Pamela?
Yes, I'm very comfortable.
Okay. So we're going to begin the infusion of our local anesthetic mixture, and then we'll return intermittently throughout the procedure. We are now about an hour plus into surgery, and we are tightening up the right side of the face by resuspending the underlying tissues. As you see, Pamela,
What?
she's awake, talking to us. How are you doing, Pamela?
I am doing just peachy.
Great. Are you feeling any pain at all?
No.
Fantastic. How have things been so far?
Things have been great. Easy, smooth, peaceful, wonderful. I would highly recommend
We've
it.
completed the most uncomfortable part of the procedure for the patient. Pamela, you want to tell us what you felt? And
I just felt the slightest bit of like a pinprick just for a very second, but this vibration is helping the pain and keeping my mind off of it, but nothing excruciating, nothing that I couldn't handle, just little pinpricks here and there.
excellent. So it's very important for the surgeon to exercise patience and ensure that the patient is completely numb. We don't want her experiencing pain during the procedure. Has it been a pretty comfortable experience so far?
Absolutely, I would highly recommend
Here
it.
now we're harvesting fat all under local anesthesia. You doing okay, Pamela?
I'm doing wonderful. Excellent.
So we're going to harvest fat and we're going to dermablade around the lips, and then the procedure will be complete. As you see, this can be accomplished under local anesthesia very safely with the patient being very comfortable. Morning from Hillcrest. Today we're doing a facelift, and I just want to show that if you want the scars to be inconspicuous, it's even important to pay attention to the details of the markings. Everything should be a curve because all our anatomy is filled with curves. So gentle markings following the curve of behind the ear, up, round, and a down, gently curving into the hairline makes a difference between a visible scar and an invisible one. Thank you.
Facelift surgery eliminates sagging skin, wrinkles, and other signs of aging for a vibrant appearance. May involve injecting fillers around the neck, cheeks, lips, and jowls. Incisions around the ears and hairline for non-noticeable scars. Reposition fat, tighten muscles, and cut away excess skin.
Another huge part of our practice is rhinoplasty. And we see the full spectrum of patients from rhinoplasty as well as otoplasty. A significant portion of the population wants to have just the nasal tip altered. And that nasal tip is easily altered under just pure local anesthetic with oral sedation. A shortened recovery and a beautiful result. So what's different about a rhinoplasty or Hillcrest plastic surgery? So we're going to take the time with you and we're going to figure out exactly what you want. Details are important when it comes to rhinoplasty. And because we do a lot of ethnic rhinoplasty, and that stretches from the lightest complexion to the darkest skin, it's important to take into consideration ethnic attributes and keeping that face in congruity. Most patients that want something changed about their nose want a nose that's in sync with their face. And that is the single most important thing for your surgeon to remember.
Rhinoplasty, designed to help both nose form and function. Open. Incision is placed along the columella, results in minimal scarring. Closed. Incisions are made inside the nostrils to prevent visible scarring. Makes nose more symmetrical and repairs functional issues that affect breathing and smell. Liquid rhinoplasty. Injection of dermal fillers into the nose to alter its shape. Great option for isolated deformities such as a dorsal hump or minor asymmetries. Instant results, more affordable than surgery, very little downtime, and natural looking results.
Otoplasty is when you have prominence of the ear, meaning the ear sticks out a little bit too much from the side of the head. That comes from two things. You have all the normal parts, they're just not the right architecture. And so what we'll do is we'll lessen the depth of the ball. All of this is done through an incision behind the ear, and we'll shape the ear to make it look more aesthetically pleasing. There are a few patients who actually want the ear reduced, and that too can be accomplished.
Fillers, non-surgical facial rejuvenation treatment. Reduce the appearance of fine lines, wrinkles, and acne scars. Enhance, define, and contour facial features. Augment the cheeks and lips. Very little downtime, easy maintenance, and natural looking results.
Welcome to Hillcrest Plastic Surgery, where I'm going to be having filler along my jaw and mouth area by the amazing Dr. Spence. Together we decide on having Juvederm Ultra Plus put in a triangle around my mouth area and Voluma underneath along the jaw to give a sharper look. Oh wow, I can hardly believe my eyes with the first sneak peek. Next, Dr. Spence injects Voluma along the jawline. Wow, what a difference already. Like he did on the right side of my face, Dr. Spence will now inject Juvederm Ultra Plus on the left side of my face for my jowls. He'll then inject Voluma along my left jawline. Wow, I'm obsessed with these results, which will last about 7 to 9 months.
Hi, I'm Dr. Fernando Ovalle with Hillcrest Plastic Surgery. I'm a double board certified plastic surgeon and obesity medicine specialist. I practice the whole spectrum of plastic and reconstructive surgery, but I specialize in breast and body procedures to help patients achieve their body contouring goals. I also train specifically in obesity medicine so that I can offer patients the latest and best evidence-based medical weight loss offerings and achieve a truly comprehensive body contouring program.
Breast surgery, breast augmentation, shaping, and enhancement. Types offered: breast augmentation, lift, implant revision, reduction, and male breast reduction. Each plan developed by one of our knowledgeable and experienced surgeons boosts self-esteem and positively impacts body image. 3 to 6 weeks recovery.
Dr. Ovalle, breast and body contouring is your thing. And we know that there are a lot of patients out there who want curves. They want a fuller buttock and they want a larger buttock. Tell us about ultrasound and buttock augmentation.
Absolutely. This is an exciting time to be a part of buttock augmentation surgery, especially with the use of the ultrasound. Using that, we can use fat to deliver targeted volume, shape, and curves in a very safe manner by ensuring that we're staying above the muscle.
Abdominoplasty removes the excess belly fat and loose skin, improves the shape and appearance of your abdomen, addresses concerns that can occur due to aging, weight gain, or pregnancy. Different types: full tummy tuck, mini tummy tuck, and high lateral tension tummy tuck. Reverse tummy tuck addresses loose skin above the belly button, helps to achieve a toned upper abdomen appearance. Incision is made below the breast to pull the excess skin up and create a toned upper abdomen. Recommended for patients with excess skin and sagging in the upper abdomen but not in the lower abdomen.
Welcome everyone. So here at Hillcrest we always have something going on. Keloids, lasers, scars. Right now we're going to pop into the International Center for Keloid and Scar Treatment and see what's going on. Hi everybody.
Hello.
How are you today?
Good.
You doing well?
Doing great.
How has your experience been with us here?
Oh, wonderful.
Everything good?
Smooth.
Yeah. Dr. Ovalle, you want to share with us what you're doing today?
Yeah, absolutely. Our patient here had a very bothersome keloid scar on his forearm that we removed. We closed with all absorbable sutures in a tension-free manner. And today we are completing his SRT, or superficial radiation treatment, and that's to help the keloid scar have the least possible chance of coming back because they do have a high recurrence rate.
Thank you so much for sharing with us.
Absolutely.
All right.
Yes.
Hope you enjoy the rest of your time.
Thank you very much.
Keloid removal for raised scars found on the skin surface that comes after a healed wound. Non-invasive keloid treatments include steroids, laser therapy, pressure therapy, or injections. A large keloid non-responsive to the less invasive treatment options requires surgery to remove the keloid scar tissue entirely.
Hey y'all, wanted to share some additional information about our weight loss program at Hillcrest Plastic Surgery. Plastic surgeons, we love helping patients reach and attain their aesthetic goals. There may be times when there are some that aren't quite ready to have that cosmetic procedure, and this could be due to the fact that they're not at their goal weight. Good news is that with our additional expertise and board certification in obesity medicine, that we're able and committed to helping patients safely effectively lose weight so you can reach your goals. Hey guys, Dr. Ovalle got another FAQ about some more specifics about how our program works, Hillcrest Plastic Surgery. To give you a little bit more background, if you were someone that's interested in losing weight and you reach out to us, that we do speak with our patient inquiry specialists who are very helpful at giving you some preliminary information and structure of how the program works. But briefly, there are some intake forms for you to fill out, as well as blood work tests to get in order for us to review where you're at in terms of your health and weight and your goals, and to see how we can safely and effectively help you get to where you need to be. Then we'd like to set up a consultation, and that can be either in person or virtual at your convenience, that we will review that weight and medical history with you. We're going to give you a key overview of nutrition, activity, behavior, and mindfulness, as well as prescribe, if appropriate, evidence-based weight loss medication, and discuss what to expect moving forward. So with our expertise and board certification in obesity medicine, we are committed to help patients safely and effectively lose and manage their weight. Our program does take a very comprehensive approach and includes facets in nutrition, activity, behavior, as well as evidence-based weight loss medications. With respect to the medications, we do offer a full range of medications from the latest injectables such as semaglutide and tirzepatide, as well as other well-established oral anti-obesity medications for those who may not be candidates or don't wish to do the injection. We believe that there is something for everyone, and some patients may have good success without any medications at all. But whatever the case is, our program wants to give you the tools and knowledge to put you in a position to be successful with your weight loss goals. Good question. An obesity medicine doctor is a physician who specializes in the treatment of overweight and obesity, which are chronic conditions that affect millions of patients in our country. An obesity medicine doctor can help these patients through many different ways, including the management and changing of nutrition, activity, behavior, and of course the prescription of evidence-based weight loss medications. The American Board of Obesity Medicine, or the ABOM, is the organization that provides certification to physicians in this field. And board certification in this field means that a physician has undergone specific training and has reached a level of expertise and commitment to taking care of these patients. As a double board certified plastic surgeon and obesity medicine specialist, I'm very lucky and love bringing a unique approach and a very comprehensive approach to taking care of patients who come to see me and helping them inside and out and reach their goals. Our practice takes a very personalized, in-depth, and comprehensive approach to weight loss that includes different facets of obesity medicine, which are nutrition, activity, behavioral and mindfulness changes, as well as evidence-based weight loss medications. We are also the only practice in the country that has dual board certifications in plastic surgery and obesity medicine. So yes, we can complement the passionate, physician-driven medical weight loss care with our expert plastic surgery, surgical and non-surgical offerings of the face, breast, and body.
Chemical peels are not solely subjected to the face, but can also be applied to the body if discoloration and/or texture is present. The patient's main concern was to address the sunspots on their mid-forearms and back of hands. Prior to administering the peel, the patient was placed on a regimen with topicals that assisted with lifting the pigment to prepare the skin. Depending upon the Fitzpatrick that the patient is classified under, will not only determine the strength of the solution that is used, but the number of layers required to achieve desired results. Please be mindful that darkening of the treatment area is to be expected as the days progress post-peel. The dead skin is being exfoliated, thus pushing it to the surface before it peels.
We're using the Research FX, which is a fractional non-ablative laser. What do we mean by non-ablative? It means we're not burning off the top surface of the skin, which leads to what? A much more comfortable experience and a much shorter recovery. Here at Hillcrest, we like to combine the Research FX with an IPL treatment in patients with concerns of both pigment and texture, and that combination serves us very well.
I think that it is the atmosphere, it's the people that work here. You walk in and it's warm, everybody is inviting. You don't feel different. You don't feel like, oh, I should be on the cloak of darkness doing this. Not at all. It is the easiest, most comfortable place I've ever been to. Not that I've done this like many times, But once you walk in the door, you're greeted like family. By the time you're in the back, you know that you're a family. You're leaving, everybody cares about you.
Hi, my name's Galen, and I came to Dr. Spence nearly 10 years ago. And I actually just came in to have some lips done because he had a website with really good lips, and my lips are very small. But he left me in a room with his playbook, and when he came back in, I said, "You can do this?" And he said, "Yes, that's what I do." I said, "You can do this?" And so I ended up having a facelift with Dr. Spence. And he's not only a perfectionist, but he has a great bedside manner, and he gives you great confidence. And when he came into the room, he brought with him his nurse who had been with him for 8 years, which is another indication that he's a person who practices well, and he takes care of his people, and they have their confidence in him as well. So if anyone wants a recommendation for Dr. Spence, they have mine.
Sí, buenos días. Mi nombre es Marcelina Sosa. Estoy aquí en la clínica de Dr. Spence, que me acaba de hacer un Netflix. La verdad es que estoy maravillada porque mi cara lucía muy triste y avejentada. Me daba una expresión de persona casi amargada o triste, así. Pero con el trabajo que me ha hecho el Dr. Spence, estoy fascinada. Fueron más que mi expectativa, lo que resurgió en mí. Estoy encantada, estoy fascinada y le recomendaría a cualquiera que tenga este mismo problema mío, que venga y se ponga en la mano del Dr. Spence. Es una maravilla. La verdad es que creo que hizo un milagro en mí. Podrán ver la foto de antes y después y se darán cuenta que el resultado fue magnífico.
I have the most wonderful doctor. I love this place. Check out my cheek. That's one. Wait till they do the other one. Hello, 5 stars and beyond. Come here, get it done.
We're so thankful for our wonderful patients, and we love making them feel youthful and refreshed with all sorts of offerings that we have, including hyaluronic acid fillers.